Hi, I'm Frank Diamond, the managing editor of Infection Control Today. We're trying to give infection preventionists and others on the front lines battling COVID 19 and other infections the information they need to help them do their jobs. Joining me today is Dr. Fibi Attia, the Infection Prevention Coordinator at Penn State Milton S. Hersey Medical Center. Dr. Attia is also a member of Infection Control Today's editorial advisory board. I mentioned other infections other than COVID 19, that is, because they haven't been on vacation during this pandemic. Dr. Attia has published articles in peer reviewed journals about just how effective ultraviolet light might be in dealing with such healthcare acquired infections as C. diff. Her conclusion, at least as far as this layman can tell, is that ultraviolet light doesn't really cut down on C. diff spread that much. But more to the point, and lately, Dr. Attia has helped heaped a lot of praise on her fellow infection preventionists about how they're dealing with COVID 19. Dr. Attia, thanks for being with us today.
Hi, nice meeting you. Thanks for having me today.
That's a beautiful background.
Thank you.
Let's start with a broad question. Uh, what do you think makes a strong infection control and prevention program?
So infection control and prevention is a very effective thing in all the healthcare settings, hospitals, long-term care facilities. It's very helpful to have a strong infection prevention and control program. This way you are trying to help people not get more infections, trying to reduce infections in your hospital, and also maintaining a healthy environment all over the community, not just in the hospital. Because if you are improving the health for the staff members and your patients, then it's all over the community. It's not just the hospital. So in this pandemic, we learned a lot. As infection preventionists, we did learn a lot because it's different when you put a plan together, what you're gonna do if there is a pandemic, and what's really happening. So when you are in a real pandemic, it's very different. So you get a lot of challenges to maintain this plan going on.
What was one of the main things that you learned, and were you able to keep to your predetermined plan? I understand a lot of infection prevention programs had to kind of make it up as they went along.
Yes. So we had developed a plan, a pandemic plan, prior to the COVID-19 in regard to Ebola when it started in 2014. So we started doing a real plan, real good plan. And then this plan is like something that is put together, discussing how we're gonna deal with a patient coming in with certain highly infectious disease, and what if it's a surge, what's if a lot of people, who is gonna deal with this patient, what kind of protective equipment that they're gonna have, those kind of things. And those were put nicely in a plan. But in real life, there are some details that you don't detect unless you are really in this pandemic.
In normal times, I mean, before COVID-19, what do you think separated a good infection and prevention control program from an excellent infection prevention and control program?
I would say proper educating staff members on proper hand hygiene, standard precautions, which is the universal precautions, considering everybody could have a potential infection. So if you have this in front of you, like, okay, this person may have an infection, so I have to protect myself, then I have to take standard precautions, which is if I'm anticipating a splash or something like a bodily fluid, then I would wear a gown, gloves, something for my eyes to protect my face. Those kind of things are um, are called standard precautions. So those are the most important things, and of course, hand hygiene is the best thing ever. Yeah,
Now,
go ahead.
now there are standard precautions, and there are also isolation precautions, I believe.
Yes.
What are the differences between those two?
So standard precautions is for everybody. There are two different kinds of precautions. They're standard and they're transmission based. So standard precautions is considering everybody kind of infectious. So if I am touching bodily fluid, then I have to put gloves on. If I am anticipating somebody's coughing or having respiratory symptoms, then I have to protect my face, my eyes, nose, mouth. So I have to put a mask on, maybe a face shield to protect myself. If I'm anticipating a splash, for example, or a vomiting or something like that, then I have to wear a gown. Transmission based is I have to do that based on the infection that this patient has. So I know that this patient has an infection. I know for real. And according to this, everybody I am in the room, I have to wear my protective equipment according to this transmission-based precautions. So it's not like standard precautions, not all the time that I'm wearing a gown, all the time I'm wearing a face mask, but it depends on what condition are you anticipating. But transmission-based is all the time that you're interacting with this patient.
So isolation precautions or transmission precautions
Yes.
are much more intense.
Yes, they are. Yes.
And they were much more in use during COVID-19.
In COVID-19, yes, it is. It's also like contact precaution, droplet, or airborne. It depends on if you're doing aerosolized producing procedure, the AGP, aerosolized generating procedure, then you have to have an airborne precautions, which is N95, face shield, or a PAPR.
How receptive are your fellow healthcare workers to being educated about infection prevention? And has that changed because of COVID-19?
So we had done a lot of training sessions in the start of the pandemic. We have been doing those sessions on a quarterly basis. So for everybody doing PPE, personal protective equipment, they have to know how to put on and how to take off their PPE without contaminating themselves. So with the pandemic, when it started, we made it kind of recorded training. So it is available to everybody, all our staff members, and also some in-life trainings that made it, I would say, more concentrated on this PPE for the COVID-19. So how to put a face shield on, how to wipe it down, what to do with the mask, where to put it in after you take it off, how long are you using it, and those kind of things. So without contaminating yourself and without contaminating any other thing.
In your experience, do infection preventionists educate patients as well, or do they educate staff and leave it up to the staff to tell patients how to better protect themselves?
For infection prevention, we educate staff, and staff are anticipated to educate the patients. So we do have like kind of survey for outpatient clinics, asking the patient, have your healthcare provider washed in and washed out? Have they wiped down everything? Those kind of questions. So educating the patients that they should anticipate that the healthcare provider that taking care of them, they should wash their hands in and wash their hands out before touching them.
Have you noticed that patients are much more cognizant of infection prevention protocols since COVID-19?
I think so. I think everybody is aware of what's happening. Also, we require that patients coming into the hospital or any clinics that they wear a mask on. And we encourage telehealth. So if you're anticipating any respiratory symptoms, any fever, any kind of things, then you talk to the provider first and ask her questions. If you need something like a swab or something, then we have a drive-through that you can go in and get your swab done. So it is, I think all the community know what's happening now, and they know how to protect themselves, kind of.
Sure. What was the main challenge in your job, or I would say in the job of infection preventionists in general before COVID-19? And now, what's the main job after? What's the main challenge after COVID-19?
So before COVID-19, it's hard to make people stick to proper hand hygiene, proper techniques, wiping down equipment properly. So that was the main challenge: cleaning equipment, proper hand hygiene. Those are the main things that were happening prior to COVID. Main challenges after COVID-19 is that you don't know if your patient that you're seeing has COVID-19 or not, because some patients are asymptomatic and they can be infectious. So the challenge is what to wear, like what kind of PPE to protect yourself. If you're seeing a patient who is coming in for like a pre-op screening, preoperative,
right,
and is asymptomatic, but then the swab came back positive. So what's the exposure risk? So the exposure risk were one of the big challenges that we're facing.
Is contact tracing also another big challenge?
Kind of, yes, yes.
When you say
we're trying hard, but
when you say kind of, is it something that is just difficult to do, or there's no?
No, because you don't know for this patient or that employee who he was in contact with, like in community based, like was he in Giant or Walmart or going to the gas station or getting some coffee? You don't know. It's hard to do contact tracing if it's a community spread. It's so hard to do it.
Do you think there'll be changes in how infection preventionists approach contact tracing as a result of this?
I don't know, but I think for now, for now we are doing great. But if we are anticipating a surge or something, then it would be hard to do it.
Okay, you are on our editorial advisory board, so do you have any advice for your fellow infection preventionists on how to proceed, not only with COVID, but in the post-COVID world, which we all hope is coming at some point?
Yeah, we all hope that the vaccine will be coming soon. But for now, um, I would advise everybody to take their full precautions. Whenever seeing anybody, even asymptomatic patients, that you take your precaution, maintain social distance, frequent hand hygiene, wear your mask on, and don't touch your face.
Dr. Fibi Attia, thank you so much for visiting Infection Control today.
You're welcome.
It's just
Thank
another day.
you.
It's just another day on the beach for you, right?
Yes, correct.